Your teeth don't need 10 products. Stop overcomplicating your oral care. Welcome back to my channel. I am Dr. Salman Khan and this is DrBraces YouTube channel, the only channel that gives you real, honest advice, no paid influence, no sponsorships and no AI generated scripts, just a doctor giving honest dental education, what I would give to my patients, my friends and my own family. So today we are going to set a new oral care routine, a minimal one which will be very useful for you in this year 2026. Without further ado, let's jump right in. So if taking care of your teeth feels confusing or overwhelming with all the information overload, then this is the video you only need. You don't need 6 or 7 different types of oral care products like skincare. You don't need different types of toothbrushes. You don't need different types of mouthwashes, and most importantly, you don't need multiple whitening hacks that are promoted on social media. Let's keep it simple. One simple mantra for your oral care routine for 2026. Habits and consistency is far more important than glamorous tooth whitening hacks. So as I said, social media makes oral care look like you need multiple products and you need morning routine, you need evening routine, you need hacks and you need different whitening products. I will tell you something very simple, a very simple routine which largely depends on your habits and not on the amount of money that you are going to invest on these products. So a simple place where we start is remove plaque, don't damage your enamel and do not ignore any warning signs. That's enough for you to have a lifetime of set routine care that takes care of your teeth. So number one, I know with all dentists say brushing twice a day, morning once before breakfast, night just before you hit the bed. No over excessive brushing, just 2 minutes. Use a soft bristled or extra soft toothbrush in circular motions. If you are interested in the exact brushing techniques, put in the comment below and I will make a video on it. Make sure you use a basic toothpaste. Brush for about 2 minutes, rinse thoroughly. This consistently done every day without missing is far more effective than using a fancy toothpaste which you use only once in a week or once in a month. Instead, focus on using a basic toothbrush, basic toothpaste, but show up every single day, every single night. Number two, your toothpaste, keep it basic. You don't need activated charcoal, you don't need salt, you don't need so many excessively marketed toothpaste, whitening toothpaste, serums and all of that. You need a basic toothpaste. It needs to have few key ingredients. Number one, it needs to have fluoride in it. Number two, it needs to be low abrasion, and number three, it should be suitable for daily use. Number three, and the most important here, is flossing. Yes, I cannot stress enough, whatever brush you use, no matter which ultrasonic toothbrush or a expensive toothpaste you use, if you're not flossing in between your teeth with a simple threaded floss, you are not doing justice to your teeth, because flossing clears about 30% of your tooth surface. The toothbrush only covers 70%. So floss every night consistently. I don't care whether you use oral flosser or you use a waxed dental floss, but anything will do to support your flossing goals. And number four, which is commonly misunderstood, a mouthwash. Look, a mouthwash is optional. You don't necessarily need to use a mouthwash every day. In fact, using a wrong mouthwash can increase the bad breath, because alcoholic mouthwashes dry your oral tissues and also kill good bacteria along with bad bacteria that leads to more recurring odor. So I would suggest skip the mouthwash if it's not really necessary, and get the mouthwash only prescribed by your doctor and use it periodically under your doctor's supervision. Next, let's talk about what you can skip. You can skip whitening toothpaste, you can skip brushing and whitening hacks, you can skip all these lemon baking soda and baking powder and carbonated peroxide at home whitening kits to whiten your teeth, and brushing multiple times, more than 2 times a day, 3 times a day, 4 times a day, and complicated oral devices. All of these, they don't need to be there in 2026 in your routine. What I have explained, these simple 3 things are enough for you to have a healthy oral health. In fact, overdoing all these hacks, so-called hacks, has a chance of increasing sensitivity, accidentally damaging your teeth, eroding more enamel, causing more problems, and in turn landing up in our dentist office. I hope this information was precise, concise, and if you've loved this video, please share it with someone who does not do the habits regularly and overcomplicates their oral routine. Share it with your loved ones, share it with your family, and most importantly, please do subscribe to my channel, and that helps me motivate and show up for you week on week and deliver honest dental education without any prejudice. Also, I want to talk to you about something very important. Not every treatment, not every routine can take care of any other hidden problem. So what we do whenever we have a problem and we get a pain, so what the patients immediately do, they go for a painkiller over the counter, they take it and the pain disappears. You need to remember the pain has just temporarily silenced, you have just taken care of the symptoms, but underneath lying problem is never solved. And this problem after a few weeks to a few months comes back and bites you even stronger, and then you come up with a far worse problem to begin with. In my next video, I'm going to exactly talk about why painkillers are not suitable, not advised for your dental pain, and what you should be doing instead. So stick around for my next video. Until then, bye bye.